signs of an unwell baby. So things to look out for when you go home: if baby has any sort of colour change that is concerning you, even if baby's a bit jaundiced or you're concerned that baby is becoming a bit more jaundiced, let us know at Pregnancy Assessment Unit. We can do a triage over the phone to make sure baby is clinically well, or whether we need to get a midwife to come out and see you that day. If baby has any sort of dusky colour change or turns a bit blue, the best thing to do is to phone an ambulance and get baby brought into hospital straight away. Want to look out for baby's temperature as well. The best way to check a baby's temperature is the back of their neck or their little chest with 2 fingers, just like so. If baby is hot or sweaty or showing signs of a fever, also just bring baby in to be seen, or if you're very concerned, again, just phone an ambulance. Want to make sure baby's breathing rate is okay, so looking out to make sure baby's respiration rate is the way it should be and not too fast. An increased respiration rate could also be a sign of infection in baby, and we want to make sure that baby is being seen. We want to make sure baby is feeding nice and regularly, so whether that's breast or bottle feeding, baby is waking for feeds and is nice and settled following feeds. So also things to look out for, and looking out for signs of illness in baby. Just monitoring baby's nappy output as well. So there is a wee slide coming up about nappy output and what to expect in terms of nappies. We want to know how frequently baby is passing urine, what colour baby's poos are, how often baby is pooing. If you feel like baby isn't passing urine, or the urine is very concentrated within the nappy, or if baby is not past opening its bowels, we want to know about that as well. This can all come together with feeding and reduced feeding and reduced nappy output are something that we like to know about, so that we can come and support your baby and do a clinical assessment of baby as well. So we're now going to talk about cord care. So looking out for sort of signs of infection around the cord. So what happens is baby's cord will dry up and fall off usually within about 10 days post delivery. It will dry up, it will go black and crispy and have a bit of a funny smell. When the cord is about to fall off, it will smell like baby's got a dirty nappy when it doesn't have. You might find the cord anywhere about the nappies or in baby's baby grow. When a big concern is if there was any sort of red patches around baby's skin, if it was starting to track up baby's body at all, if it was hot to touch, these can all be signs of early risk of infection as well. We also want to make sure that baby look out for baby's crying pattern as well. So all babies cry is completely normal, but we want to know if baby is high-pitched crying uncontrollably and can't stop, or if baby won't settle at all. These can also be signs that baby needs a clinical assessment. So like I say, you'll be sent home with this wee discharge leaflet that has all those wee tables in there like we showed at the start. Any concerns you do have, you've got the pregnancy assessment contact number 24 hours a day, 7 days a week. Please don't hesitate to get in touch. However, if you are majorly concerned and you think baby needs to be seen straight away, or yourself needs to be seen straight away, just phone yourself an ambulance and be seen faster.